The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health Livestream with yours truly, Dr. Tom Roselle. And we're going to kind of get into the crux today a little bit about, why you're starting to lose your mind a little bit, maybe, and maybe you're not making decisions as rapidly, and maybe that you're scared to death that you'll forget your own name at some point. That's called neurodegenerative disease. And it happens generally after many different things, but we're going to focus on is head trauma, post-injury, but injury that may have occurred years ago and now is catching up with you. It's catching up with you at a level that is starting to scare you. So first we understand what happens, and then what's your risk level? How much of, forgetfulness should you be paying attention to? It? All kinds of different forgetfulness, and we'll talk about that in a second as well. But I want you to understand something that I see and have seen, if you will, thousands of patients over a period of decades. And there's a lot of similarity in certain conditions. And what we're talking about today is neurocognitive degenerative diseases. What are they like? One big one, Alzheimer's, lateral myotrophic sclerosis, Lou Gehrig's disease. We're talking about just general forgetfulness or the inability to pick something up without shaking, like what? Like a Parkinsonian problem. Those are all neurodegenerative conditions, and there are really many others. Aphasic patterns, like our dear friend Bruce Willis right now is suffering significantly, and it's from that type of situation. It's a neurodegenerative problem that, where did it come from? Who knows? He's lived a very active life. Those of you who've been in the military have taken all kinds of blows and traumas just going through basic training. You've had punji sticks, you've been on the ground, you've hit your head, you had trauma concussive patterns due to explosions around you, even though that, it was set up as a training procedure. If you were a scuba diver and you get in deep under the water, that pressure, that compression on the spinal fluid, on the cranial plates can cause significant problems over a period of time if you don't decompress the way you're supposed to. If you're a skydiver, if you're a skier, if you get up to 10,000 feet, again, there are different forces that cause the meninges, the attachments of the brain to be irritated, maybe developing scar tissue, but stopping the communication process from one to the other. We just finished kind of leading into this on WMAL 105.9 FM in the Washington metropolitan area just a few minutes ago. And I want to take you the next step. I want you to understand the risk of neurodegenerative changes. I want you to really get it, because here's the deal. Post-concussive syndromes, or what we call TBIs, causing neurodegeneration after head injury is significant. If you look at the literature, it says something in the neighborhood of up to about 5%, and actually the current literature says even more. That quote goes back to about 7 years ago, about 2018. There was a group of guys that really try to do a broad-based study. It was published in the journal Neurodegenerative Diseases, actually the British Medical Journal, which they're way ahead of the game when it comes to reporting things and observing things, my opinion. But nevertheless, it's, you need to know, you need to have the data. So let's get into that just a little bit and really understand the intimacies, if you will, of what this is all about. So neurodegenerative disease after head injury, what's the risk? And what does it really present like? So we know that there's an associated dramatic increased risk due to all kinds of head injury. A head injury is a car accident. It's a spinning type of injury. It's playing football. It's hitting your head with a soccer ball. It's the other things that we just talked about. Now, what happens is that what we see is that not only the 5% of all these cases go into dementia state, what we sometimes think is an old age loss of memory, or worse, Alzheimer's, right? But it's more than just that. There's things that can take place. Um, it's like you have to really understand that some of these subtle changes are due to things that have happened to the brain over a period of years. And so we really need to understand that. So let's go back to one of my favorite journals. And there was an article that was published in the British Medical Journal, actually neurology and neurosurgery and psychiatry, if you will. And it goes back a whole bunch of years ago, and they updated it recently. Uh, but I want you to kind of get an understanding of it. It's understanding neurodegeneration after traumatic brain injury. And they went into understanding not only what happens, but as far as the pathology and the tissue changes and so forth, but also the subtle changes that took place over a period of time. The mechanism, and this is the important piece that you have to understand, the mechanisms by which trauma can trigger neurodegeneration are beginning to really be understood. We didn't think it was this, if you will, meaning, what really was in front of us, like just a blow and so forth, and swelling the brain. But what we're seeing is that there's a very diffuse injury to the connective neurons, if you will, what they call axonal pathways. And they're finger pointing now and saying that these potential injuries now cause what we call the tau proteins and the amyloid proteins to develop, leading to what? Alzheimer's and so forth. Not a good thing. The neuropathology of this post-trauma induced dementia is very noticeable. But up until now, we weren't quite sure what was causing it. But what I want to leave you with is this, as we go through, is that it's reversible in many situations. There's things that can be done as long as we understand what the key mechanisms are around it. So brain shrinkage, if we want to use that term, is brain atrophy, and it shows up on MRI and imaging and so forth, is a key measure of degenerative disease and progression over a period of time. And it's finger pointing to what we just talked about, this loss of axonal neuronal pathways. Now, they also look at something called fluid biomarkers. And these are little fibers and filaments, that can be set up on imaging. We can see them very, very specifically. But what happens, these neurodegenerative processes can show up almost immediately, and sometimes not to much later after brain trauma, brain injury, of all the things that we've talked about up until now. So what I want to get into is simply this. What's the risk level of something like this happening? The British Journal says as much as 15% of all dementia. We just said, 9 years ago, there was 5%. Well, the British Journal is saying that 15% of all dementia cases are attributable to traumatic brain injury. And now that's just one piece of the puzzle. We're not talking about the other things that can come about as a result of that. What are we talking about? It can go even to death and disability, the inability to use your hands because something's not connecting anymore. The lower brainstem controls the memory of being able to do certain physical tasks without thinking. It's the automatic. It's going out for a dance, knowing the dance steps. It's doing exercise, knowing what, without even thinking about doing it, you do it. That's the lower portion of the brain. After traumatic brain injury, we begin to see an insult that occurs into the neural connections, if you will, and we start seeing this loss of processing, not only physically, but loss of memory, processing speeds relative to problem solving. We call that executive functioning skills, assessments, risk behaviors, and so forth. And then all of a sudden, long-term dementia patterns show up, and we're looking at the very severe things like Parkinson's and also the granddaddy of all of them, Alzheimer's. So we have to really understand that the risk level is significant. So if you have something that has happened or has happened repetitively over a period of many years, you have quite a significant increased risk of developing a problem. 15% of cases that of all dementia cases are attributable to this type of thing. But I think that number is even higher. But here's the other piece: they really haven't attributed, if you will, what the risk level is for other types of patterns, focusing, eye injury, loss of hearing. All of these things can be not just old age set up and loss of the little fibers in your ears called the cilia, they're in the inside of the ear called the cochlea, but they can be as a result of neural miscommunication between one part of the brain and another. And so we start seeing these subtle patterns, and they're significant. And what we're noticing is that there's an increased presentation. Now, is that due? The argument is it due to the better understanding of it and better diagnostic patterns? Maybe, and that could be a real situation that we get it now, so we understand it. So we're seeing these things show up, but the overall presentation, if you will, of more and more neurodegenerative processes in front of us that seem to be post-traumatic, but we have to understand the post-traumatic presentation. What does that really mean? Let's go back to that just for a second. So we know things that are significant, like a boxer in the ring or a wrestler in the ring or somebody smacking their head all the time doing something. We know that those are significant injuries. We know that car accidents, the ricochet, if you will, the hyperextension, hyperflexion, or hyperflexion, hyperextension injury depends on the direction that you're being hit within the car. So if you get hit from behind, your head is going to go back like this. And then when the forward movement stops, then your head goes forward. That's the whipping action. Conversely, if you're hit from the front, your head is going to go like this. It's going to flex forward, and then it's going to go backwards. That's an injury pattern. Now I'm going to give you some subtle injuries. What's a subtle injury? You're on your cell phone all day long, or your head's down and you're on your computer all day long. That is causing an irritation, an injury pattern, if you will, to the lower portion of the brainstem, pulling on the covering of the cord. That is going to be injured scar tissue due to chronic swelling and irritation and inflammation over a period of time. So think about what it is that you do all the time. Think about the positions that you get yourself into. Are you always in a position where you turn too quickly and you have a torsion of the neck? I have a patient that was in a car accident, and the nose of the car was hit. It spun the car. And so when the car stopped, she wasn't physically injured, but her neck was sore because of the twisting, but it affected the brain. What happened to her? She went into repetitive low-level seizure patterns. And as a result of that, repetitively over time, she started losing her cognition, her capacity to remember things. And, on a current day-to-day situation, she's still quick, she's still sharp, but some of the old things that she should know to be able to connect the pieces as a result of that. So here's the thing. It wasn't a blow. You ask her afterwards, how'd you feel after the accident? I was, I guess I was okay. I was just a little stiff. But the torsion effect, the off-centering of the covering of the cord, the dura, and as it relates to the bony positions of the neck and the head and so forth, were enough now that it caused other things to begin to show. So taking a similar approach to improving diagnosis of people over time, and really understanding the type of degeneration that's in front of us begins to give us a little different key to why people begin to lose balance, if you will, where they get dizzy, they get syncopic episodes where the world starts spinning and turning, where they can't feel not just two fingers. That can come from your neck and irritation here. And we see that every day in our patients and fix that well. But sometimes just tactile sense when you go to put a button on and you can't feel the button anymore. You don't have the dexterity that you used to have. How many of you, played an instrument and all of a sudden now, because of, you don't know why, but you don't have that piece down the way that you used to have it. And you can't understand why it was so easy for you back in the day. It has to do with age, only time that has passed, ignoring something that may have been building up over a period of many, many years. So how common is this situation with traumatic induced first head injury due to dementia? We'll talk about that, right? So there was a meta-analysis that was recently done of 2 million people. That's a big, big, big cohort. It's huge. And what they saw was over 1.6, closer to 1.7 times the risk of dementia is present after head injury. That's huge. Now, when was that done? That was done 2015. So when we're looking way back at 2015, do we start seeing more of them today because we can diagnose better? My guess is, yeah, absolutely. That number is very low compared to what it should be. There was a study that was done with veterans. We talked about that just a moment ago. And 200,000 U.S. veterans with traumatic brain injury were evaluated. Remember, I said it can be as a result of what? Explosions. It can be as a result of falling. It was a result of getting hit in the head. It was a result of a lot of things. And what they were seeing is that there was a significant increase in the severity of ongoing, not only dementia, but loss of capacity and ability to function, and neurological muscular stammering, if you will. It's not a complete tremor shaking, but it's the inability to hold steady. Now, it's kind of interesting stuff. So you go through and you start looking, and they've done things with pathologies on autopsy and so forth. But we really have to understand the complications that can occur as a result of brain injury and the risk that we're associated with it. So we can have altered states of consciousness, if you will. And it doesn't mean that we have to go into a vegetative state. There's a lot of neuroscientists out there that are saying that sometimes people just space out, and they didn't do that before. And it's, they say, well, I'm just going into an altered state. No, it's a result of something that had happened. Seizure patterns, what we just talked about. We're talking about pressure in the head. We're talking about headaches, even reoccurrent infections. How can an infection come about as a result of head trauma? Because you have a lot of signaling that goes from the central nervous system to your immune system. And if it's not working the way it's supposed to, we already know that the upper portion of the spine, cervical 1 and 2, controls healing process and also autoimmune reactions within the body. It's been demonstrated over and over and over again. So if you have pressure and distortion due to injury in that area, your immune system's not going to work the way it's supposed to. Nerve damage where you no longer can sense or feel something significant, and goes on. We know we're talking about cognitive patterns here and the like. So what I want you to understand is that this is not something that is, it happens to the other guy. It can happen to all of us in subtle forms. There's, in a TBI situation, a neurological condition that may show up is secondary to trauma is called pseudobulbar effect, or sometimes it's pseudobulbar palsy and so forth. And it has significant effect on your body's ability to function neuromuscularly. So, we start looking crossways in the literature, and we want to look at the risk factors and so forth. So we look at the risk factors, and those are the important things. There's an article, if you will, out of Mayo Clinic, and it talked about traumatic brain injury and, from violent blows or a jolt to the head or, something that nature, something that hits or causes a shock. And that's the piece I want you to understand, is a shock. It doesn't have to be a physical blow to the system, causing everything from headaches and vomiting and nausea and fatigue and drowsiness, slurred speech. You don't articulate the way you're supposed to. How about when you feel that your mouth and your tongue are uncoordinated? You can't express the words the way that you used to. That can be a result of post-traumatic injury. Again, post-traumatic injury can be anything from mild to very severe, but it's not just because you took a punch in the head or you got fell down and you hit your head on the ground, it can be as a result of concussive patterns around you anywhere, or a torsion of the covering of the brain. And those are the important things. So, we can see mood changes and frontal lobe problems where their executive functioning, you can have this dazed state, this kind of, out of it type of thing. And then we get into more severe situations, where we end up with the convulsions and the nausea and the seizures and severe agitation. I mean, very, very severe agitation, slurred speech and so forth. And we think they had a stroke, but it's not a stroke. It's an injury pattern to the brain where the brain is no longer communicating. So when should you do something about it? Well, I've treated hundreds and hundreds of elite athletes over my career. And we not only watch them relative to swelling and eye gaze and memory patterns in the initial situation, but we also, from our point of view, we want to see what the tissue mechanical compliance is. You've got 22 bones that make up your head. In trauma, those bones lock, and they don't move as gently and with respiration as they were meant to, pumping spinal fluid back and forth. So if they do lock, then you have a buildup of pressure in the spinal cord. In structural physical medicine, you can find that out. There's ways of testing the skull bones, the cervical spine, and so forth, and see if they're doing what they're supposed to be doing. Now, when you have a trauma, that's the time to get checked. And you all of a sudden see subtle changes. Not a big deal, no big deal. Well, it's just kind of lingering problem. I need to go work out and stretch. Maybe you better go get checked out. Maybe you better go see a chiropractor. Maybe go see the person that you trust that does really good manual medicine and who understands neurology to be able to help you. Maybe at that point, your neurotransmitters aren't doing what they're supposed to be doing. And by the way, I'm going to add a little bit of I didn't know that to this conversation. If you get punched in the gut, in the stomach, in the intestinal tract, you could have symptoms of post-traumatic injury to the brain. You say, what? What does my gut have to do with that? When you get hit in the gut, you can disrupt the transmission, the production of your neurotransmitters, because 75% of your neurotransmitters are produced in the intestinal tract. That's why it's called the second brain. So not only the brain can be problematic if you get a direct shot to the head or you get a concussive pattern, but anything that puts pressure, irritation, concussive, blow, trauma to your intestinal system can also cause a lot of these different conditions. So think about falls off the bed, falls off a ladder, fighting all the time. Now, you can't go into a cocoon and hide. You just have to be aware that some of these things can cause problems. How about falls, motorcycle accidents? I played sports my whole life. I've had car accidents. I've skied. I've jumped out of perfectly good airplanes. I've done all kinds of dumb stuff, but many of us have done stuff. It was a lot of fun. I probably wouldn't change 5 minutes of anything, but it was a really good time. So, so your risk factors are this: children that are young, 4 years old and under, newborns to 4, because of the way we carry them sometimes, how they fall. Young adults between 15 and 24. Why? Because they're active, they're playing sports. The impact at their age is much harder. Adults over 60. Why is that? Because they don't have the neuromechanical skills to protect themselves that they used to. And guess what? Guess who's more susceptible than anybody else? Guys, us, men at any age. Why? Because we're young. We go out and we do what we do, and we go out and fight the tiger every day long, and we don't think about stuff that can take place. But the complications can be significant over a period of time. They can be coma. They can be going into the inability to focus. If it gets really bad, it's called a vegetative state, or going to middle conscious state, or killing off certain areas of the brain. So there's no communication. You can end up with heart failure because of it. Why? Because the nerves that come from the lower portion, the vagus nerve, our old friend you've heard me talk about, goes to the upper chambers of the heart. And if that vagus nerve is swollen, the heart's going to misfire. And guess what happens? It could miss beats, it could stop, you could pass out, you got a problem. So we look at all these things that we've talked about, and there's many more, but we have to understand the risk level. What is the risk level of post-traumatic injury? Much more significant than what we think if it is not taken care of. But I want to leave you with this today. It can be resolved. It can be put back. Your body is an amazing ongoing healing mechanism. We used to think that the brain could not regenerate. We know today that it can. So, but we have to understand what may have taken place. We've got to restore normal function, whether it's cranial plates, whether it's the upper cervical vertebrae, whether it's the neurochemistry that's there to make sure that there's enough of it to heal the body. If you start seeing, facial paralysis, and what I mean by that is this, all of a sudden you smile like this, but one side of your face kind of lags behind the other side, which it didn't do before. That's a clue that the nerve of facial expression may not be working the way it's supposed to as a result of something, particularly if it's obvious, it's there. What happened? It could be anything, but it could be a very significant post-injury type of presentation. Loss of vision or double vision. If the upper portion of your neck and the lower portion of your brainstem has any kind of compression due to injury, you're going to lose the ability to focus. Your eyes aren't going to hone in the way they're supposed to. And you're going to go to the doc, and my eyes are changing, and you want new glasses. You're going to get another pair of glasses. You get those glasses, and it could be a problem. The ability to swallow. I'll give you one that you hadn't thought about. How about sleep apnea? That comes from the inability of the back of the throat to be able to work quickly like it used to. What causes that? Well, it can come from injury. It can come from the glossopharyngeal and hypoglossus nerve not working the way it's supposed to. Brainstem nerves that can do to injury. So we got all of the stuff ringing in the ears and syncopic patterns and so forth. So what I want you to understand, and we'll get into the next programs as we go through the treatment process and the identification process. But I want you to understand that your risk level can be significant when it comes to putting something off. Guys, you're number one on the chopping block here. We have a tendency not to pay attention, to ignore things. Oh, it's nothing. And then later on, we kind of put the tag on, well, I never paid attention to myself, and what do I expect for my age? I don't know about the rest of you, but I'm trying to make it better all the time. I'm doing word games all the time. I exercise, I meditate, I make sure that my dietary patterns, and guess what? I get structural treatment on an ongoing basis, well, acupuncture and laser therapies and so forth. And if you're watching this program right now, if you look over this side and you see that box, if you will, many of you have heard of Royal Rife. It goes back to about 1900 plus, in the time of Tesla and all these brilliant physicists and so forth. It's a Rife frequency generator, and we're playing with it. We're seeing how it affects the energy platforms of the body. So we're trying to constantly add different pieces of the puzzle to our treatment modalities and see how patients respond to those things. Because my job, as long as I'm here, is to find out as much as I can possibly find out so I can serve you. So you have an understanding of the things that are available to you that can make a difference, that you're not stuck where you're at. You've got to be able to change the process. So when I hear somebody say, what do I expect for my age, or what should I expect for my age? If you're asking me, you're going to hear something like anything and everything that you want, as long as you're willing to put the time in and being able to put things together. Please understand that if you ever had an injury and you didn't do anything about it, if you ever had a blow or trauma, you were near an explosion, or you were explosions all the time, you were working out in a construction crew where there was blasting going on, when you were in a certain position repetitively over time, you're in a class and you're jumping up and down. That jumping up and down sometimes will cause a problem, but if you ignore the problem, now you have something that might be worse moving back up. Infections, swelling of the meninges, it's called meningitis. That can be a problem too if it's not completely taken care of. In today's world with COVID and other infections that get in the body, Lyme's disease, that's some of the things that we're seeing as a result of that inflammatory reaction, and also that neuroaxial communication that's disrupted, and we don't have, and then ultimately the buildup of other things that we know that cause problems like the tau proteins, the amyloid proteins. I hope I'm triggering interest. My job is to provoke you. My job is to make you think. My job is to say, what did he say? He's got to be out of his mind. Go look it up. Go look and read the journals that are out there. Go to the Towson letter, go to Frontier, go to PubMed, go to the British Medical Journal, there's tons of them, but do the reading. Don't stop at one. Don't stop at one. Keep reading, and you're smart people. You get it. You'll understand, and you'll understand also that sometimes you're being manipulated by one, people don't really understand it as well as you could if you did the homework, because they haven't done their homework. But number two, that there's agenda sometimes, and we won't get into that in today's program. But having said that, I hope this helps a little bit. Understand that your risk level can be significant if you don't pay attention to what's really taking place, and to be able to turn this around. Join me next week, and I promise I have an add-on for you that will be quite interesting. We'll let you know about that throughout the week. And we're coming up. We have a program in-house that we want you to register. In front of you right now, you're going to see. Just go to drtomroselle.com and register for the class. I promise you it's going to be very interesting. We're going to be talking about head trauma, concussions, and I'm going to do some demonstrations. I'm going to show you what it looks like. I'm going to show you what takes place. But more importantly, I'm going to show you some interesting things of what can be done quickly and to be able to resolve things the way they should be resolved. Remember, I'm here all the time for you, and only for one reason. I love you all. See you next time. Take care. Bye.